If I am aware that the Assembly is in caucus, the Democrats, so if I can have Assembly members, staff come down here with a letter, they can present. Otherwise, we're going to close this. If you want your bills heard, you have to send staff down here with a letter. Otherwise, I'm going to close it. I'm going to go to 1:15. Then I'm going to close it. Date my bills.
Start as a subcommittee.
We're going to start as a subcommittee. Mr. Jones, please come up. You have your bill. Item 4, AB 171.
Make sure that this thing is
I left it over there. No, I thought it was in here. Oh, I left it on the table. Okay. Go ahead, sir.
Madam Chair, Senators, thank you very much for the opportunity to present AB 171, which provides additional consumer protection to patients offered credit arrangements at dental offices. This bill does a number of things, but one of the most important is it prohibits dentists or their employees from arranging credit for services that have not yet been received unless the patient is first given a specified written notice and treatment plan. It also requires a written notice to be provided in the patient's primary language. It prohibits the arrangement of credit for patients under the influence of anesthesia, and it requires a refund within 15 business days of a patient's request for any payment made by the patient for services that have not yet been received. We took a number of amendments, particularly those at the request of the Department of Managed Health Care, to ensure that all of the plans that are regulated by DMHC are in compliance with the requirements of the bill. And so the bill is sponsored by the Western Center on Law and Poverty in response to a series of incidents involving patients who were asked to get into credit arrangements without fully understanding that, in fact, they were entering into credit arrangements instead of just payment plans. We're very pleased to have the support of the California Dental Association. We've worked very closely with them this year to make sure that this bill has their support, as well as a number of other consumer advocacy groups. The bill has no votes, and we do have some witnesses we'd like to testify on behalf of the bill.
Thank you. Witnesses in support.
Madam Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty. We are the sponsors of the bill. As Mr. Jones indicated, this is in direct response to a number of complaints our local offices got from low-income consumers who were signed up for dental credit cards. Some of them thought they were agreeing to a payment plan with the dentist's office and didn't know till they got the credit card bill what it actually was. We had a number of elderly and non-English speaking clients signed up for credit cards under concerning circumstances, and the bill is narrowly tailored to the kinds of cases that we have seen. We've been pleased to work with the California Dental Association and to respond to the Department of Managed Healthcare's concerns about staff model dental plans and practices in those contexts. Happy to answer any questions you have and urge your aye vote. Thank you.
Other witnesses?
Yes, Madam Chair and members, Carrie Gordon, California Dental Association. As has already been said, we are in support of this bill. We are very pleased with the conversations that got us to the compromises that we have here. They do reflect the ethical standard dental office practice and should resolve the concerns that brought this to our attention. Thank you.
Thank you.
Hi, Sherry Lowenstein with the Department of Managed Healthcare. We want to thank the author and sponsors for working with us to address our concerns with this bill through our medical survey and financial audit systems, as well as consumer complaints. We've seen a number of problems in this area, specifically with our staff model dental plans, and we appreciate the changes to this bill to address those issues so that we can fully enforce the law. Thank you.
Thank you. Any other witnesses in support? Are there any witnesses in opposition? Seeing none, questions from the members? Senator Correa.
Yeah, question for the author, Mr. Jones. So we have a scenario where somebody goes in, needs dental work, and they get a quote and they apply for a credit card on the spot? Is that what you've got?
What has happened in some circumstances, and I can ask the sponsor to speak more specifically about particular instances, but in some circumstances, folks have gotten in the chair and ended up with a credit card thinking that, in fact, what they were entering into was some sort of a payment plan. So we've sat down with a dentist and worked through a series of common sense protections that reflect the best practices of dentists across the state of California, the highest ethical and best practices of dentists, and we've worked out with them all of the issues and concerns that they might have had about it, and we're very pleased to have their support and have had unanimous support as the bill has moved along. So I think this really makes sure that everybody is operating with the highest standards to make sure that folks aren't inadvertently put in positions that they didn't think they were going to be put in.
Well, let me, if I can ask specifically to somebody. So you get, again, I'll repeat my question. You got somebody who gets a application for credit. They sign up for credit while they're on the chair, or they sign up for a credit card?
Before or after anesthesia?
Senator, happy to respond to your question. I don't know all of the individual circumstances, but yes, we're talking about, in some cases, elderly folks who are being signed up for dental credit cards, not knowing what they're agreeing to. I think it's sort of a totality of the circumstances. Most of us trust our dentists, and most of us have good reason to trust our dentists, but we have had some consumers where the dentists haven't behaved ethically who have been signed up for dental credit cards under concerning circumstances.
And I presume it's not only signed up for a dental credit card, you walk away with a charge on your credit card?
Yes, and to be clear, for example, we had someone who went in for a dental cleaning. The dentist said, you need this deep cleaning, these root canals, and said, here's the full treatment plan. That will be $6,000. They walked away with $6,000 on a credit card that day, including a number of services that were not received that day.
Just from the department's perspective, pretty much what she's describing is what we've seen, where essentially it could be a treatment plan for 6 months, for a year, for 2 years, 3 years, and essentially it's, if you want to get all these services, you can pay it up front this way. Sometimes they may be offering a discount for the dental staff models are not really allowed to do that, but they're still saying you can do these things up front. It is effectively a credit card that gets charged on that particular day. Ultimately, they may or may not down the line get all those services or not. That's one of the issues with refunds, is whether or not they actually do carry through and get all the services over that time. But that's essentially what it is. It's like when you sign up for, like I did recently, for like pest protection. I signed up for a year. I paid it up front. Said instead of $400, it was $350 or something like that. It's that kind of situation. It's very similar.
So under this bill, if you get one of those, treatment plans over, 6 months, for example, then under this bill you can still apply for this credit card, or you can't, or
The pre-charging is still allowable under the current version of the bill.
but you can't charge until you actually get the benefit,
No,
treatment.
you still can, but we've tried to put some protections in place to make sure the consumer understands what's happening. So subsection A of the bill actually requires that you get a list of what services you're not getting that day that you're paying for, and also make sure you have a treatment plan and a disclosure form.
Thank you.
Thank you.
I'd like to take the opportunity to add that, and I think that the author and the sponsor agree that by and large these products are used well. They're used. So many Californians don't have dental insurance to cover the scope of the work that they need. This is an opportunity as a financing mechanism. But we wanted to make sure that you weren't charged for something and held to that if you weren't going to receive the services, so you could receive a refund within 15 days if you didn't want to go through with the services and some of the other protections that Elizabeth mentioned. But I do think we did decide that's why we want to continue to allow these, is by and large they're used well. But there have been these limited but substantial abuses where we wanted to make sure those didn't continue to happen.
Did you have a question? No, just remove the bill. Well, we're in a sub right now because, we don't have enough members.
We don't?
We only have 4.
Right now.
Right now.
That's all we need.
No, it's not.
This guy could run a committee with just himself, right?
That's why we have Dave Jones here to watch me.
I know my place. I'm here, not up there. Madam Chair, thank you very much. I really appreciate the committee's attention to the bill, and we've tried to strike that appropriate balance by providing more information to consumers and more protections at the same time, allowing dentists to use this arrangement and patients to use this arrangement as well. We'd ask for your aye vote.
Thank you very much. Okay, so we're still waiting. Okay, I saw Mr. Ng come in and Ms. Conway after that. Mr. Ng? Mr. Ng has item 6, AB 370, unlicensed contractors. Good afternoon, Mr. Ng. Okay.
Good afternoon, Madam Chair, members, and thank you for the honor of presenting this bill again. With your permission, I will just proceed very briefly. As you know, contractor fraud, especially unlicensed contractors, is an epidemic nationally. It's estimated that we lose about $100 billion. As an example, an individual recently went to the home of a 75-year-old property owner and was hired to make repairs. The contractor, who was unlicensed, got $85,000 for the work and abandoned the project. Under current law, the offender could be punished, but the victim got nothing unless he or she sues in civil court. This bill requires the unlicensed contractor to provide restitution to the victim in criminal court for actual damages lost. The bill also increases the maximum potential fine for the first offense from $1,000 to $5,000, and concurrently for second and subsequent offenses increases the mandatory fine up to $5,000. This bill also corrects a very critical flaw in the current law for the third offense by requiring both a fine and imprisonment. This bill is sponsored by the Office of the LA City Attorney. It's co-sponsored by the Contractor State License Board and a coalition of builders, laborers, and AARP, among others. The bill has no registered opposition, and this committee unanimously passed a nearly identical bill last year. Here to speak on behalf of the bill is Michael Brown for the Contractor State License Board.
Thank you. Members in support.
Michael Brown for the Contractors Board, co-sponsor of the bill. This simply is a piece of consumer legislation that at the same time will serve the industry, the honest, tax-paying, hardworking construction industry. We respectfully request your aye vote.
Thank you. Others in support?
Yes, Skip Dahm on behalf of the American Subcontractors Association, 400 member companies. The bill is timely and certainly needed given the economy. Thank you.
Thank you.
Thank you, Madam Chair. Park Terry for the California Landscape Contractors Association. I don't think I need to remind members of the committee that licensed contractors who play by the rules are severely disadvantaged by the underground economy and the unlicensed contracting activity that takes place. Not only do we feel imposed upon by this, but typically unlicensed contractors don't deduct payroll taxes. They don't pay workers' compensation premiums. They ignore worker health and safety laws. And for all those reasons, we think this is an excellent piece of legislation. We urge your aye vote.
Thank you.
Madam Chair, Phil Vermeulen, representing the engineering contractors and various other contractor associations. Strong support. This is a very important bill. Urge your aye vote. Thank you.
Madam Chair, members, Richard Markson, representing the American Fire Sprinkler Association and the Western Electrical Contractors Association. Glad to support the author and the sponsors of this measure.
Thank you. Malcolm?
Thank you. Carrie Mazzoni, Government Strategies for the Executive Council of Homeowners in support of the bill. Thank you.
And Todd Bloomstein on behalf of the Southern California Contractors, also in support. Thank you.
Thank you. Any others? Is there anyone here in opposition? Seeing none. Questions from the members? No questions. Would you care to close?
Respectfully request an aye vote.
Okay. And you understand we don't have enough members. We will take this up as soon as we do. Thank you very much.
Thank you.
Ms. Conway was next. She has AB 1074-8 on the agenda.
Good afternoon. Thank you, Madam Chair and members.
Welcome.
I'm here today with AB 1074. 1074 addresses a loophole in current law in regard to contractors' licenses. As you all know, the Contractor State License Board issues license to contractors who meet the necessary safety and experience requirements in a particular field. Currently, a contractor can be punished for fraudulently doing business under another's existing license number. However, no law prohibits an individual from making up a contractor state license number. By correcting some simple language in the Business and Professions Code, both actions would become violations to further protect consumers and licensed contractors. Michael Brown from the State Contractors License Board is here with me to testify or answer any questions that you may have.
I think the question I have is, they just take up numbers and put them on a piece of paper?
What typically happens, Senator, is the non-licensed contractor would just make up a number or perhaps use a business license number that they have and represent it as a contractor's license number. As the statute's currently written, we would actually have to prove that a valid contractor's license number was used. This change would allow us to prosecute an unlicensed contractor who led the consumer to believe that the number that they made up was a contractor's license number and then defrauded them subsequently.
Okay. Others, members?
Madam Chair, Skip Dahm again for the American Subcontractor Association's 400 construction companies. This bill is a protection for consumers as well as the law-abiding subcontractors. Again, in this economy, we need a fair, level playing field, and this does it. Thank you.
Just briefly, Madam Chair, again, Park Terry for the Landscape Contractors Association. Another excellent bill to address this problem. Mike Brown explained the need for the bill. I can't say anything further, so we urge your aye vote.
Thank you.
Madam Chair, Phil Vermeulen, Engineering Contractors, Marin Builders Association, and various other contractor associations. Very important bill. Urge your aye vote.
Thank you.
Madam Chair, Richard Markson, American Fire Sprinkler Association, Western Electrical Contractors Association, in strong support.
And again, Todd Blooms on behalf of the Southern California Contractors in support as well.
Okay. Mr. Codwell, will you try to get up? Oh, okay. Wrong bill. Okay.
But you could testify if you wanted, sir.
Okay. Any questions from the members? Would you care to close?
Respectfully ask for your aye vote, and thank you very
and
much.
you understand we don't have enough members yet, so we will take that bill up.
Yes, ma'am. Thank you.
You okay? She has a question.
Just a quick one. I mean, what just kind of dawns on me is that we had an earlier bill that just says, unlicensed, and here you've got fraudulent. Why not just, in terms of its economy, just combine the two notions and put it in one bill? Was there a particular reason why you need to separate this issue?
I defer to you on that.
Okay, next time I have a bill, I'll have you join me.
All right. The chair spoke, and I understand what she's saying.
It's probably because we don't have conference before we put our bills forward.
Yeah. Okay, thank you so much. And I saw Ms. Carter was here. Ms. Carter has item 5, AB 252. And we need some members so that we're not... Yes, yeah, I know what they're... Okay, Ms. Carter, go ahead.
Thank you, Madam Chair and members. I'm presenting AB 252, a bill on the practice of medicine. Last year, a bipartisan vote of this committee approved the substance of my AB 252. AB 252 helps accomplish the medical board and nursing board stated goals of strengthening enforcement of current laws and going after the most frequent lawbreakers, illegal, corporate-owned med spas operators who unlawfully rent medical directors. These outfits simply want to practice medicine without proper licensures or ownership structure. The substantial improvement in penalties for illegal corporate practitioners of medicine in the cosmetic medical arena in AB 252 will justify the commitment of enforcement resources to these kinds of cases by the Medical Board of California and other consumer protection agencies and will more effectively deter would-be lawbreakers. AB 252 also put doctors who aid and abet the illegal corporate practice of medicine that they too will face enhanced discipline, including potential revocation of their license. The finding of our two consumer protection bill, Medical Board of California and the Board of Registered Nurses, following a series of public hearings in 2007 around the state, centered around strategies to improve enforcement. This bill is strongly supported by the bill's sponsors, the American Society of Dermatologic Surgery, together with CalDerm, the American Medical Association, and many others. I have with me today Dr. Suzanne Kilmer, a board-certified dermatologist from Northern California, here to testify in support.
Witnesses in support?
Yes, hi. I just want to support that these are not cosmetic treatments, but really the practice of medicine. And I'll give you just one small vignette. And I have many patients with similar issues and problems, and I'm kind of the fix-it person in town, and I don't want to have to do that. But this is a particular indication to support the practice of medicine. 29-year-old woman goes to a salon to have her sunspots removed. They do ask her if she's been in a tanning bed in the last couple of weeks, and she says, yes, I did 3 weeks ago. They proceed to treat her anyways, never ask her any other family history. She has a sister with a melanoma, a grandmother that died of melanoma. So they treat her little 3-millimeter spots with a large, just an illustration, handpiece that basically leaves her these big spots. They blister, they depigment her, and then, as you can look at these closer if you'd like, the little spots come back, and now they look very irregular. And my job as her dermatologist is to decide which of these are potentially melanoma because she has dysplastic nevi, and she's at definitely increased risk for this. So I would support that MDs should be in charge of the patient. There should be, some discussion with the patient, some physical exam, and some following of that patient. When she had problems with the blistering, there was no MD available for several weeks to follow up and help her with her blistering. So I'm sorry if I'm frustrated, but I really would love for the patient to be the bottom line here. Thank you.
Thank you. Other witnesses?
Madam Chair, members, Tom Riley with Osteopathic Physicians and Surgeons of California. I urge you to support this bill.
Madam Chair, John Valencia here representing the sponsor, the American Society for Dermatologic Surgery. I'll simply echo what Ms. Carter said and mention briefly that we met with the opposition which surfaced last week, the Department of Consumer Affairs. I think we're in agreement that the bad acts are in fact bad acts. The question really is about the tools that need to be employed in this situation. We appreciate the fact that the Medical Board of California supports the measure. These are not tools that they can create for themselves, but rather need the legislature to do that for them, to arm them. We'd ask for your aye vote. Thank you.
Thank you.
John Caldwell on behalf of the California Society of Dermatology and Dermatologic Surgery, CalDerm. We're in strong support of the bill. Doctors that participate in these rent-a-doc schemes should be punished, and that's what the idea here is.
Thank you.
Madam Chair, members, Bryce Doherty on behalf of the California Academy of Eye Physicians and Surgeons and the California Academy of Physician Assistants in strong support. Thank you.
Thank you. Anybody else in support of the bill? Is there any opposition? Come forward, please.
Brian Warren on behalf of the Department of Consumer Affairs. We're in opposition to this bill. We are for the prosecution of unlicensed practice of medicine, but that's already punishable as either a misdemeanor or a felony, and we believe that this bill is duplicative of existing law.
Okay. All right. Thank you. Thank you. Any questions from any of the members?
I have a question.
Yes, go ahead, Dr. Anastet.
For the department, if indeed this is duplicative and it's already against the law, why is not the Department of Consumer Affairs actively closing down these corporate-owned medical spas that are practicing illegally?
Well, I think that the working groups that was held between the medical board and the nursing board agreed that there was a gap in the enforcement, and they felt that just stronger enforcement of existing law, stronger enforcement against the prohibition of the unlicensed practice of medicine was the most effective way to carry on.
Don't you think by passing this bill, which is very specific in addressing the subject, the Department of Consumer Affairs might get the message that maybe that gap should not be there?
Well, we just feel that this bill is, the bill itself states that it's declaratory of existing law, and we feel this bill is unnecessary right now.
Well, something is necessary to get the department to start enforcing the law. Thank you.
Thank you.
Thank you, sir. Okay, and no one else? Yes.
Question. Just very quickly, this bill is what, in its second year? There was another bill like this last year.
That's correct, Senator. It was AB 2398 by Assemblymember Nakanishi, which the committee approved.
And what happened to that bill?
It was held on third reading. Frankly, it got tied up in a little inter-house, intramural activities having nothing to do with the measure.
No.
Not that that happens in the Capitol, Senator. But frankly, we think on its merits, it was poised to go to the governor. It arrives here on a 79-0 bipartisan vote. We're optimistic about its outcome, and we'll continue working with the department to see that that happens.
All right, thank you.
Yes.
I believe, however, the bill is different and better. I voted against last year's bill because it was a mandatory revocation of the doctor's license, which I thought was severely punitive. You make one mistake and you lose your license and your livelihood. This one now gives it to the discretion of the medical board, so I think it's a much better and a different bill that I'm going to vote for.
Would you care to close?
Well, I respectfully ask for your aye vote and of all the members. Thank you so much. Thank you,
I'll
Senator.
repeat what I said. We don't have enough members here. We're working as a sub. Okay? So as soon as we get them, we'll move the bills.
Thank you so much.
Thank you, Madam Chair.
And our last bill on the agenda is item 9, AB 1416, Galgiani.
Thank you, Madam Chair and members. Approval of a vocational nursing or psychiatric technician program is a lengthy process that currently takes a minimum of 1 year. Within the process, schools interested in offering vocational nursing or psychiatric tech programs submit an application to the board, who reviews the application and supporting material. After board staff determines the program meets specified criteria, the board grants approval for the school to run an initial class. Before the graduation of the initial class, Business and Professions Codes mandates board staff perform an on-site visit in which the board recommends to grant or deny accreditation. Due to the nursing shortages, colleges and private institutions are ramping up their efforts to request new programs and expand their existing authority for class start dates in the various healthcare fields. The Board of Vocational Nursing and Psychiatric Technicians is inundated with requests to review and approve new nursing programs, but does not have sufficient numbers of nursing education consultants available to perform the ongoing on-site visits. This bill will clarify that the board has discretion to conduct an inspection by site visit or by review of documents required by the board, or both, for initial accreditation. The evaluation of written documents has proven successful for continued accreditation and is fiscally prudent, especially during these difficult budget times. I'm pleased to have with me Ann Schumann, Supervising Nursing Education Consultant for the Board of Nursing and Psychiatric Technicians, to testify in support and answer any technical questions that you might have. I ask for your aye vote.
Witnesses in support.
Good afternoon. The Board of Vocational Nursing and Psychiatric Technicians is the sponsor of this bill. We feel that as a special fund agency, the bill will allow us to more efficiently manage our resources, and we would ask for your aye vote. I'll be happy to answer any questions if you have them.
Do you have questions? Yes.
I have a question not related to the bill.
Oh.
It seems like the trend in hospitals across the state is to get rid of vocational nurses in favor of RNs. And yet I see the number of schools for vocational nursing is significantly increasing. Where are these folks finding jobs?
Many of the LVNs are finding jobs in long-term care and home health facilities.
Okay, thank you.
Are going on to Dr. Onested's question, the hospitals are not using LVNs at all?
They are.
Okay.
They are. Some are using them. When we brought in the ratios, patient-to-nurse ratios, there was, and I'm really not the one, my board is not really the one to speak to that, but the ratios did cause some concern about the number of RNs that could be available versus the number of LVNs to care for the patients in compliance with the ratios. Of course, with the economic downturn now, there are fewer RNs and LVNs being employed because requests for elective health care is going down. So it is a problem from a couple of perspectives.
Any other witnesses in support? Or is there anyone here in opposition to speak?
Madam Chair, members, Stephanie Roberson on behalf of the California Nurses Association here in opposition to the bill. We're opposed to the bill because we feel it will dilute standards for evaluation and approval of nursing programs under this bill. According to the bill's fact sheet, the BVMPT has approved 97 new vocational nursing programs over the past 5 years. The BVMPT Sunset Review report of September 2002 states that there were over 101 VN programs and 14 PT programs at the time of joint legislative sunset review. So that's a net increase of 97 schools, and that represents an 84% increase in the number of programs during the recent years. So with that information and those statistics, we felt that didn't support the need for diluting standards.
How do you figure? How do you figure it's going to dilute standards?
Well, in the bill, as you read it, they do have discretion to use on-site if they wish. But when we look at some of these issues, if you have discretionary oversight for the on-site inspection along with the written, they're just going to go towards the written. And we feel if you look at the appropriations analysis and the supporters of the bill say that this is going to save a lot of money, it's minimal cost to the state. It's not going to save a lot of money. So why would you eliminate and dilute standards? They might as well just keep it in place. As you look at other info in the bill, they say that they use their discretion to do this or not anyway, so why do you need the bill? So that's kind of our sense of it. You should just keep it in place.
Lydia Bourne, representing California Nurses Association. I would make one other point with the elimination of the private post-secondary and vocational education commission. We believe that is another reason that on-site visits have to be made. The post-secondary commission would offer some oversight to most of these private programs. And again, if you look at the information that they supplied, about 20% or 30% of these programs are in private schools, and now we have a lack of oversight. They did speak to the fact that there are increased calls coming in, but we also believe that with this large number of private institutions trying to open up programs, you do need to have on-site inspections. Just one other issue I would make in response to Senator Arnsted's program about the diminution of LVNs in the hospital setting. We're finding that patients are coming in with much higher acuity, and therefore you need staff with higher level skills in order to care for these patients.
I just wanted to add too, Madam Chair, next week we're going to be going into extensive discussions over the BVMPT issue, the board and consolidation issue, and next Monday, we just ask that you just take a look at this and take a hold, because if the consolidation does move forward, we need to take a look at how this affects further boards and consolidation. So we ask for your no vote at this time. Wait for further policy committee discussions to see how this impacts a consolidation move if that is approved.
Madam Chair, may I respond?
Yes.
CNA's opposition really is not factual. The exact same regulations are reviewed, whether we do it via review of forms from the program, or whether we do it via an actual site visit. We're actually looking for compliance at the exact same regulations. So that really is not an accurate statement. Relative to there being no Bureau for Private Post-Secondary and Vocational Education, the board does not have authority to review the same areas that the Bureau would be responsible for, namely for the oversight of an educational entity that houses a vocational nursing program or a psychiatric technician program. We have authority only over the VN or Psych Tech program. The other factors that would fall under the Bureau still would not come to us. We would have no authority to look at that.
The Bureau actually does the facilities, is that correct?
That's correct. They look at
you only
fiscal
do the criteria,
personnel.
the curriculum.
Right. We would urge your aye vote.
Thank you. Questions, anybody? We still don't have enough members. Thank you. Would you care to close?
Thank you. This is an effort to move the process forward during difficult budget times, and especially during the times when we have a shortage of nursing. And I would suggest, too, that by doing this, we allow the board to better use their resources and make decisions about going after those who are blatantly in violation as well. Thank you.
Thank you. Are we getting somebody? Okay. Yeah.
They're right in caucus. They're going to come right on over.
They're going to come over. Okay. It's off. Call the members.
For a quorum? Negrete McLeod?
Here.
Wyland? Onestad? Corbett?
Here.
Correa? Flores? Oropeza? Romero?
Here.
Walters?
Here.
Yee.
Here.
We have a quorum.
We have a quorum? We have a quorum. We have 4 bills on consent, 2 with amendments, technical amendments. The consent calendar has been moved. Called for the roll.
Negrete McLeod?
Aye.
Negrete McLeod, aye. Wyland? Onestad? Onestad, aye. Corbett? Corbett, aye. Correa? Flores? Oropeza? Romero?
Aye.
Romero, aye. Walters? Walters, aye. Yee. Yee, aye.
Okay, we heard Bill 4, AB 171.
Move the bill.
The bill has been moved.
Negrete McLeod?
Aye.
Negrete McLeod, aye. Wyland? Onestad? Onestad, aye. Corbett? Corbett, aye. Correa? Flores? Oropeza? Romero?
Aye.
Romero, aye. Walters? Walters, aye. Yee. Yee, aye. 6-0.
The bill, we will hold the bill, we will hold the roll open. Mr. Correa will come back. Mr. Weiland, I understand, is absent. Ms. Oropeza is absent. And who else is absent? Flores. So we have 3 absent members, so I will hold the roll open for Mr. Correa. We heard item 5, AB 252, Carter. Dr. Onestad was going to move the bill. Is that correct? Dr. Onestad moves the bill. Called for the roll.
Negrete McLeod?
Aye.
Negrete McLeod, aye. Wyland? Onestad? Onestad, aye. Corbett? Corbett, aye. Correa? Flores? Oropeza? Romero? Romero, aye. Walters? Walters, aye. Yee. Yee, aye.
That bill is out, but we will hold the roll open for Mr. Correa. Item 6, AB 370, Mr. Ng.
Can I ask a question on this one? Just on this bill, was there any discussion at all about the impact on day laborers, if day laborers were included in this at all? That was just my concern.
No, there was absolutely no talk of that at all.
Okay, I'm going to hold off on voting and I apologize, we were in the Women's Caucus meeting, but I did have a concern about that, and so I'm probably going to lay off that till I get an answer. Hopefully we'll have votes to get out otherwise.
But day laborers, unless, go ahead.
Senator, how do you figure that day laborers would be? This primarily deals with med spas.
No,
I'm sorry.
No, Mr. Ng.
Mr. Ng. Okay.
The unlicensed contract.
You
on
wanna
AB 370. I was just
Senator, this would apply for an individual who comes and makes says that they represents themselves as a contractor, or submits a bid to do a contract for construction. I don't think that typically would apply to day laborers in that sense.
okay. So this person would have to represent themselves as a contractor.
Right.
Absolutely. Now let me. Okay, and the key question is that they would represent themselves as a contractor. The other question is in terms of victim. What if I know this person represents? This question was raised to me by somebody. I said I'll ask it, but even if I know that this person is saying that they are representing themselves and they are not, I am still a victim.
The bill explicitly says that yes, that would be the case. Even if you know that they are unlicensed and they do the contract, you still are a victim.
Mr. Ayers, and what is the threshold of the cost? It has to be above what in order for?
$500.
$500. So a day laborer probably would not do a job, over $500. Wouldn't you think so?
You have to be licensed.
Okay.
Yeah, it's just and do you have to use the term contractor, or is it within that scope of work?
It doesn't specifically, no specific reference to that, but it would be within the scope of work. Typically, what we're getting at here is people who go out and do unlicensed contracting, or
hold themselves out to be contractors.
Right. All right.
All the things that go along with that.
All right.
The license.
Okay. Thank you.
Okay. Do we have a motion to move this? The bill has been moved. Mr. Ng, call the roll.
Negrete McLeod?
Aye.
Negrete McLeod, aye. Wyland? Onestad? Onestad, aye. Corbett?
Aye.
Corbett, aye. Correa? Flores? Oropeza? Romero?
Aye.
Romero, aye. Walters? Walters, aye. Yee. Yee, aye.
Item 8 on the agenda, 1074 Conway, was contractors' fraudulent license numbers, actually using numbers that are fraudulent. Senator Romero. Okay? Move the bill. Bill has been moved.
Negretti McLeod?
Aye.
Negretti McLeod, aye. Wyland? Onestad? Aye. Onestad, aye. Corbett?
Aye.
Corbett, aye. Correa? Flores? Oropeza? Romero?
Aye.
Romero, aye. Walters? Walters, aye. Yee?
Aye.
Yee, aye.
And the last bill is item 9, AB 1416, Galgiani.
Was the opposition of the California Nurses Association withdrawn?
No.
They spoke in opposition.
They spoke in opposition, saying that it's going to dilute standards, which is the Licensed Vocational Board is asking not to do anything other than accredited. Would you?
Yeah, they're concerned about actually having the vocational board not actually go into an on-site visit. Rather, they have now the opportunity to look at the documents themselves rather than having to go out to every facility and do on-site visits.
I'll move this bill.
Negretti McLeod?
Aye.
Negretti McLeod, aye. Wyland? Onestad? Aye. Onestad, aye. Corbett? Correa? Flores? Oropeza? Romero? Walters?
Aye.
Walters, aye. Yee?
No.
Yee, no.
Romero, no.
Romero, no.
Fail,
Sorry. 3-2.
Okay. Well, we'll hold it open. Okay. Thank you very much, members. I will. If somebody will call Mr. Correa, just tell him to come up. It is going to fail. We're going to get it reconsidered.
Thank you.
The member has come back. Senator Correa has come back. So we have 4 items on consent, 2 with technical amendments. Would you like to vote on the consent
I will
agenda?
vote aye on the consent calendar, Madam.
Okay, then.
Correa, aye.
Then we had item 4, Mr. Jones, 171.
That's Correa, aye.
Correa, aye.
Item 5, 252, Ms. Carter.
Correa, aye.
Correa, aye.
Number 6, AB 370, Mr. Ng.
Correa, aye.
Correa, aye.
Number 8, 1074, Ms. Conway.
Correa, aye.
Correa,
Okay.
aye.
9, AB 1416, Ms. Galgiani.
Correa, aye.
Correa, aye.
Thank
you, Madam Chair. For
Okay, all the bills are out.
They've all passed 7-0.
They've all passed 7-0,
And-
with the exception of item 9, 1416. That bill fails. It is granted reconsideration.
Okay.
Okay. Committee's closed.